Welcome to Inside Startup Investing, the only podcast where you can invest in every guest. On this episode, I will be speaking with the founder and CEO of Pivotal Health, Sal Braico. Pivotal Health is an on-demand healthcare provider that takes the urgent care experience and brings it into your own living room. Imagine when your kids get sick, rather than having to gather them up into the car, drive to the nearest urgent care center, and wait 45 minutes around other sick people. You could just click a button and select a time for the healthcare provider to come right to your door from the convenience of your own home. That to me is an incredible patient experience and the type of step up in healthcare that is 10x better than what exists today, which is why I had to learn more. A few things that stood out to me in this episode are first, Sal and his team have already launched this solution into market with 13,000 plus visits to date and patient feedback that has been outstanding. Navigating the complexities of bringing healthcare into the home in an on-demand fashion is extremely challenging. The fact that this team has figured out the logistics of doing so on just a few $1 million raised is a testament to this team's ability to execute and prove the vision out. Second, as the team looks to scale, they have found a path to do so by partnering with brokers to sell into large employers looking to provide this as an employee benefit. My biggest question was, why would a company add this service, as it is just another healthcare cost? But in fact, by providing this service, it allows employers to choose more affordable healthcare plans for their employees, since the bulk of routine patient care can be done in this more affordable at-home setting. That story has resonated with employers, and they have seen growth from almost no employees last year to many thousands by year end. Lastly, by scaling through employers, this team is able to create the right type of local patient density that allows the logistics of a business like this to work. For instance, by working with a regional company out of Madison, Wisconsin, the bulk of their employees will live in the surrounding area. So when they sign up a few thousand new employees, those folks are within a reasonable range to service effectively. Typically, in a marketplace model, building that right density of demand can be challenging, but employers help this to scale much more effectively. So with that, let's get on to the show and welcome Sal. Sal, thanks so much for joining us today.
Thank you very much, Chris.
Yeah, so for those who don't know you, give us a little bit of background on yourself and what Pivotal Health is all about.
Yeah, well, Chris, thank you again. So I'm a healthcare entrepreneur. I've started and ran a couple of different healthcare related companies, and so I've basically been in healthcare for over 20 years. And being in healthcare for so long, I've seen how screwed up it is. Okay, healthcare is an absolute mess. There's so many fingers in the pot, so to speak, that it just sucks out money and it makes things inefficient. And it's not a good experience for patients or for providers. And so we started Pivotal Health a couple of years ago to make healthcare easier for consumers and for our providers.
When you say that, that's a very big statement, right? A very broad statement. It built a really interesting company. Let's dive in on what that actually means and what that looks like.
Yeah, so we do clinician house calls. So that means that our providers go to you. We'll go to your house, apartment, dorm room, office, job site, soccer field, wherever where you are that you need healthcare. Okay, so right there, that's the ultimate in convenience. You don't have to wait in a waiting room. You don't have to, you're just not sure if you're going to be sitting there for 30 minutes or for 3 hours. With us, you pick a time that works for you. A Pivotal Health provider comes to you at that time. And so we're treating urgent care and family practice type of needs, right? So anything that you can go to an urgent care or a primary care clinic for, those are things that our providers can treat right in your family room. Okay, so sore throats, ear infections, rashes, UTIs, lacerations, sprains, strains, all those different kinds of things. Those are things that our providers can come to you to, treat then and there.
Now, when you talk about being able to come in and treat those things, is this a nurse? Is this a nurse practitioner? Is this an actual practitioner coming to your home? Who's coming to your home or wherever it may be?
Yeah, so we've got a physician-led team of advanced practice providers. And so advanced practice providers are nurse practitioners and physician assistants. Okay, so the person that's typically coming to your home is an NP or a PA. All the folks that we have are experienced, and they're perfect for these urgent care and primary care things. But if they ever get into a situation or a case or something where they're not sure, there's always a physician that they can reach out to.
Understood. Now, at the end of the day, right, we've all used DoorDash, Uber, and these things, right? And even getting your food delivered to your home in a timely manner that kind of works for you at times can be challenging. So the idea of being able to kind of almost on demand get this nurse practitioner to show up your home to help your child or help yourself seems like a really large feat. So how are you able to kind of meet demand, where it's at, when it's at, in a way that really works for patients?
This is as much a logistics play as it is a healthcare play. That is, totally correct. And we have learned over time to appropriately staff our providers to meet the demand. Okay, so there is some seasonality to urgent care. Okay, so like during the winter months, during the colder months, there is a bigger need for this. During the warmer months, the need does drop down a little bit. So we have things like seasonal providers that kind of work during the colder months and they're off during the summertime, right? We do things like that. We increase scheduling during the colder months. I mean, I believe this is the fourth winter that we've done. So over the last 3, we've kind of learned to kind of get this really fine tuned. So now we're able to see people typically on the same day. If someone gets to us late in the day, we'll typically see them like the next morning or something. But no one minds, right? Because number one, we're not seeing people for emergency situations, right? So if you're having a heart attack or you can't breathe or something, we will tell you, hey, look, Pivotal Health is not what that is for. You need to go to the ER now. We're seeing people for those things where they're fine if they know that we're coming at a certain time, So it's been great. Patients love it. Our providers love it too. They're seeing fewer patients. They're able to spend more time with the patient. There's not like a waiting room full of angry patients waiting there. Typically with us, it's the opposite. Our providers have to fight people off who want to give them, candy and, cookies and, oh, can I, make you some coffee and stuff? And our providers say, no, I'm fine. So it's like totally flipped that whole thing.
Now, personnel-wise, it's a unique position, right? Usually nurse practitioners are used to working at one location, and now they're finding themselves on the road, having to drive around. So talk to me about the recruiting of these nurse practitioners and what the benefits are to them. Who's the typical person who wants to work for an organization like this where that meets their lifestyle or desire?
Yeah, I mean, there has been an epidemic of clinician burnout. I mean, frankly, it's a travesty. The fact that so many people go into healthcare with the intention of helping people, and they get chewed up by this system, and they get so burnt out. And I mean, during COVID, it was worse, right? And so there's a huge number of folks that want to do something different. They want to get back to actually helping people. They don't want to spend hours with all the bureaucracy and all the red tape that the traditional hospital systems have. And so we've actually had no difficulty recruiting people because so many folks are like, wait a second, I can see fewer patients? I'm like, yes. Wait, I don't have to spend hours charting? I say, yes. And you're going to pay me like, market comp? I say, yes. And so we've actually had no problem recruiting people because they just want something different. Now, is this going to be for everybody, every single provider? No. I mean, frankly, we only want people that are going to be outgoing, friendly, people that are comfortable on their feet. And, that's not all providers. And so, we're also looking for certain types of folks too.
Now, in a market model like this, right, it only works if there's enough people demanding these services and then obviously that you can meet it with your supply of healthcare providers. What regions are you in today And as you think about expansion, how do you think about that? What's the strategy?
Yeah, so we're in 3 different metro areas in Wisconsin. Okay, so the company is based in the Madison, Wisconsin area. So we're serving all of Dane County, which is like the county that Madison, Wisconsin is in. And then we also are serving 2 metro areas in northeast Wisconsin. So like in the Green Bay area, where the Packers are, right? So we serve that area, and then a little bit south of that as well. We've also, especially here in the Madison area, we've seen tremendous demand for our services with university students. Okay, so at large universities, it's difficult for the established health services department to meet the need, that healthcare need of like all the kids there. And we've got a ton of members at the University of Wisconsin campus here who love using this. I mean, I've got 2 providers on campus now, going from dorm room to apartment to dorm room, taking care of, kids. And so as we expand this business, we're looking at metro areas that have at least 500,000 people and that have a large university presence, right? So you're talking about places like Columbus, Ohio, Ann Arbor, Michigan, Boston, Washington, D.C., right? I mean, there's a lot of these big metros that have a big university. And like when I say big, I mean a university of at least 30,000 people, right? So, so that's the plan, where we can expand to these big university metros, get that quick, low CAC revenue with the university kids, while we're doing the longer sale to the rest of the population.
Understood. Now, what you're talking about here is a better level of service at your home, more convenient, so on and so forth. All of those things are great, but typically better service comes at a higher price. So in terms of your business model, how are people paying for this? Is this going through insurance? Are they ultimately paying more than they do today with a typical provider?
Yeah, so we were actually in network with most insurance companies up until August of this year. Okay, so we were in network with United and Blue Cross, Humana, Aetna, Cigna, and then most regional health insurers. And frankly, we started to see more claims getting denied. We started to get more requests for medical records. Payments were getting delayed. It was just an absolute mess. And over the past year, we've started to build up our direct business, okay? And so we decided as of August 1st, we're not going to accept insurance anymore. And so now we basically have 2 business models. One is direct to employers, okay, where employers pay us a per employee per month fee. And then their employees and their family members can schedule visits with us for about $25. And that's it. That's all that they pay. And then we have a direct to individual membership where the member or family pays us a flat fee per month, and then they could get as many visits as they want. And we launched that in around July, and we have a couple of hundred members on doing that. So we've cut out insurance, okay, and we're just going direct, but it costs less. So companies are selecting us because this is higher quality care. This is a great benefit, a great perk for their employees, and it cuts their cost. Health insurers, there's some estimates that say that they take at least, 30 to 40% of like overall healthcare revenue. Like that comes out because of, health insurers, right? United in the third quarter had revenue of $100 billion. Okay, that's more than Google. That's almost as much as Apple. Okay, so this is what we're talking about here. So by cutting out the insurance company, and the fact that we've built this platform from scratch, we're leveraging tech to automate processes. We've got a very small admin team. We've automated charting all this kind of stuff. So the fact that we were able to build this platform from scratch, we can deliver much better care at a much lower cost.
Now, the idea of selling to employers makes a lot of sense, and it certainly seems like a really good way to scale the business. I know you talk about it being more affordable. At the same time, if they're already paying for their employees' healthcare benefit, the idea this is an additional cost, right? Like, how does it drive savings for the organization?
Well, most of the employer clients that we have, they've switched to a high deductible health plan. Okay, and so a high deductible health plan is great for the company because it lowers the overall premium cost, but it's bad because it shifts a lot of those early healthcare costs to the employee. And so what ends up happening is folks push off getting care, right? Because their deductible is $7,500 or $10,000 or $15,000. And so they push off getting care, and it ends up making things worse. Then the person ends up in the ER, which is the most expensive healthcare that there possibly is, right? And so companies are kind of looking at this and saying, well, shoot, the high deductible health plan is great. If a person gets into a car accident or if they, God forbid, have cancer. But for those everyday type of things, those urgent care and those primary care things, we need to do something else. And so by even adding us in addition to their health insurance, it's still way, way less.
That's really interesting. So when you go to market and to sell to these employers, which seems like the most scalable way, especially if it's coming out of pocket, there's a cost to that, and there's only so many customers who are maybe willing to spend out of pocket. What does that sales cycle look like? And to date, what types of companies have those look like?
Yeah, so we've been actually fortunate to partner with benefit brokers. Okay, that's been our main channel to reach these employers. We do have some direct relationships with employers, but we've found that benefit brokers are the best way. And companies typically renew their benefits annually, right? So the majority of companies are on a January to December type of time frame, but there are a number of companies that do it at different quarters, right? So some will do it July 1st, some will do it April 1st, et cetera. So today we're serving over 1,000 employees at 20 something employers. Okay, and we're adding. So as of January 1st, here coming up soon, we're going to be adding at least 1,600 to 2,000 more employees. So we're excited. We're gearing up. We're raising capital to try to get a few more providers. This is really going to be fun.
That's fantastic. I certainly see the scalability of something like this. With the membership model that you have, give us a sense of kind of what that fee typically looks like. And then as you think about, driving this to be a profitable business between kind of your monthly fee per employee and then the per visit fee that's only $25, like at what point do you get to a place where you could start being profitable after all your costs to your healthcare providers, your nurse practitioners, so on and so forth?
Yeah, so on the individual side, the university students are typically paying $60 per month, okay? And they get as many visits as they need. Okay, so for the 2 semesters, we do a special where it's $540 for from August through May. Okay, so think about that: $540, as many visits as the person needs. Right? They might use us 3 times, they might use us 4 times, they might use us twice. But that's a great deal. On the employer side, it's typically $25 to $40 PEPM, so per employee per a month. So let's say the average is $35. Okay, so if you are a company that has 100 employees, you're only paying us $3,500 per month, right? And in your overall benefit spend, that's not a big amount.
Yeah.
And so, like I said, we're just able to really do this in a affordable way.
Understood. And then from a cost basis side of things, being able to provide unlimited visits, it's like insurance, right? If everyone did that, this model probably doesn't work. What do you see kind of pan out across thousands of employees typically?
Yeah, so I mean, our gross margin is about 50%, and we believe that we can get that up to 60, 65%. And I mean, for a tech-enabled healthcare services company, that's an incredible gross margin. And again, we're making it super affordable for the clients as well. This is not really jacking up prices on the consumer side, and we're able to do that. It goes back to kind of how we leverage tech. I mean, I see so much waste. There's the typical hospital system has twice as many admin and management people than they do clinicians. Twice as many. You'll have whole departments that are worried about HIPAA. And I mean, HIPAA's important, of course, but I'm saying there's just so much bloat and there's so much waste. And so the fact that we designed this from scratch, the fact that, I've seen how the sausage gets made. And so we're able to just kind of cut out all that crap.
I love that. I mean, I absolutely do believe that. And starting with a clean infrastructure rather than trying to build on top of something that's broken certainly makes a lot of sense. And frankly, you end up spending a lot of costs. I do know and have seen multiple times organizations have an incredible number of employees just to deal with the insurance companies and payments. So not needing to have a payments department dealing with them, I could understand the value right there of doing that. You've done 13,000 plus visits since I guess you launched around 2021. What are some of the key challenges and things that you've learned along the way? And why I get at that is, in many ways your moat, your defensibility is the fact that this is really hard to do, right? So I'd love to learn a little bit more about some of those really hard things that you face on a daily basis that by solving them, you make yourself a really valuable company.
Yeah, I mean, I think definitely optimizing the provider scheduling, that was a big deal. Our gross margins the first year or two, they were not very good. And so we just learned over time kind of how to really optimize that. And then we added that seasonal provider position. Most advanced practice providers are women, and we're looking for experienced ones, right? So they're typically between 30 and 50. A lot of them are moms. And so we created this position to say, hey, you can be off during the summertime, or you could be dialed back during the summertime. And that was actually a huge recruiting boon for us. People love it. They're like, wait, I can be off during summer. Like, yes. And so, I mean, that's been great. So learning those things, figuring those things out, the first year we had way too many providers on. And it's just kind of figuring that out. And then also over time, we have made our mobile app better, right? So now probably 90% of our visits are, scheduled through the app. And that's gone up over time. So when we first launched the app back in 2021, the first month I could remember, 20% of the visits were, done with the app. Now it's 85, 90%. And, people prefer the app. And there's a lot more things that we could do to really help the patient and add to the app. And so we're just going to keep on working on that. And there's more of the back office work flows and whatnot that we want to just keep on automating, And I mean, we see so many ways that we can leverage AI, too, legitimate ways that we could leverage AI to, again, keep those admin costs down.
Yeah, that makes a lot of sense. When you think, 2 to 3 years down the road from here, what does success look like for you all?
Success for us would be to be in a couple of more states to kind of get this thing, bigger. There is an almost endless need for better, cheaper, more accessible healthcare. And, there is no part of the U.S. where we can't, bring this. And so a couple years down the road, we want to make this a much bigger company. We want to have more folks employed on the team. We want to save more providers from the hospital systems. And we want to be taking care of thousands of patients each week, and we can get there. Healthcare's hard, but when you figure out the right recipe, it's a really durable product. And that's the thing about healthcare. Once you have built something, it's tough for it to disappear because people get so much value in this.
That makes a lot of sense. It certainly seems like this is an opportunity to eat away at the very fast-growing, very large urgent care market. As you think about, potential exits for the business, you think about selling to, those innovative urgent care firms that want to start to, look forward? Is it to, a private equity shop? How do you think about an exit for this business?
Yeah, I think that there are a bunch of different exit opportunities. I think, healthcare, there has been a lot of private equity activity, right? And so I think once you get a business, north of $10 million revenue, there's a lot more folks that, come knocking on your door. We've had folks kicking the tires on us already, but it's just too, early. And it just wouldn't make, sense for us to really do anything now. So we really want to kind of drive revenue to get it, north of 10 million. And then we'll see, right? We'll see if it makes sense to raise more capital to keep on growing it. We'll see what the public markets are at. And then, we'll talk with, private equity folks. We'll talk with strategic acquirers and just, different things. Or we may just kind of double down and just kind of keep on growing this. This is a big opportunity, right? Whenever I talk to anybody about this, they're like, oh my God, I would use that. Everyone says that. No one, I haven't talked to anyone that's like, I would never do that. Everyone's like, yeah, I would totally use that. And so it really resonates with people because everyone has felt that pain of you're sitting in a waiting room. You have no idea when you're going to be seen. They bring you back to the exam room, and then you talk to someone and you wait more. You have no idea how this is all going to, and so everyone understands that pain. And so the fact that we are solving that, people love it.
I'll give you the final word here for those who are kind of on the line, thinking about investing, not sure yet. What's your kind of final pitch to them?
As I said before, healthcare, when you find the working recipe for a healthcare company, it has the potential to snowball quickly. And we believe we're on the precipice of that. Okay, we're going to be adding close to 2,000 more employees onto our direct care for employers solution. That's just this year alone. And we're scratching the surface on what we can do sales and marketing wise. So I would say get in early, check us out, and come along for the ride.
If you like what you heard on the show today, you can check out why Pivotal Health scored a 4.4 out of 5 at kingscrowd.com. You can now invest on WeFunder until December 16, 2024. And please like, subscribe, and share our podcast wherever you listen to podcasts so more listeners like you can find us. Thanks for